All right, so we're ready for the last part of this process, which is donning sterile gloves. So at this point, you've put on the rest of your equipment, gown, hat, bouffant, face cover, that type of thing. And the last thing is to put the gloves on. You've already washed your hands. You assume you're pretty clean. But actually, before you do that, since you just put on your gown, we are going to use a little bit of antimicrobial hand scrub. So this is the fast drying stuff, not it's alcohol based, so it'll dry. So we're going to grab some of that first. You're going to want to make sure that that is totally rubbed in and evaporated. A, to give it time to do its work. B, to ensure that your hands are not at all moist when you try to put on the gloves. If there's any dampness left on them, it will be really hard to get your gloves on. So once you're all dry from that, you have a pair of sterile gloves here. So this is different than the typical gloves you may be seen coming out of a box in that they're individually wrapped and they're sterile inside. So we're going to take out this outer wrap here. And there's still kind of an inner wrap here that the gloves are enveloped in. So we're going to lay this out on a flat surface. We're going to make sure don't touch any part of the glove. All we touch is the paper. And we're going to unfold it here. So it's kind of easiest to do this from the bottom like this. And we pull this open. You see our gloves are nice and flat. All right. So we've opened up this package and we're ready to go. You'll see that each of these gloves is kind of folded back in on itself at the cuff here. So this cuff, there's more cuff here, but it's folded back in on itself. And that gives us a place to grab with our hands as we're putting them on. So, and you can see that there is a right and a left here. They are labeled on this package on this side. So you can see left there. So you can kind of get them in the right position looking at you. They're face up here, so I've got kind of thumbs out here on these gloves. All right, so even though you just cleaned your hands, you're assuming they are not as clean as the sterile gloves. So you don't want any part of your hands touching a part of the glove that will eventually be kind of the outward facing part of the glove. So this helps us because of this cuff. I have something to grab onto that will eventually be folded inside the glove. So you can kind of start with, generally it's gloving your dominant hand first, but whatever way you're most comfortable with. So I'm going to glove my left hand first. I'm going to use my right hand and just pinch this cuff. Remember, this cuff is going to be folded in on itself. So what I'm touching here is something that's going to be inward facing, not outward facing on this glove eventually. I'm just going to slip my hand in here like this, careful not to touch any outer part of the glove, and pull it back, and I'm done yet. I'll unroll that cuff eventually. All right. So now I can touch other parts of this glove because what's outward facing is sterile here. So now instead of just pinching the cuff, I can actually get a couple fingers up underneath this cuff. You can see how I'm up underneath the cuff, which gives me a little more leverage as I put on the second glove, right? Once I have this on, I can go ahead and kind of unroll this cuff more thoroughly on the right glove, and then I can use my now gloved right hand to unroll the cuff more thoroughly on the left-hand side. These examination gloves do not have a very large cuff. So frequently in IV rooms you will see gloves that are more like a surgical glove that have a kind of a mid-forearm cuff. It might go back to here. And in that case, if you do have something like that, that cuff is actually going to be unrolled back over the gown that you're wearing. So you're actually, the glove comes up over and you kind of create this like tight seal over the glove. But these don't have as substantial of a cuff. So you're going to unroll them both, but they won't be easily overlapped over the gown that you're wearing. And at that point, the last thing you want to do is just look these over, inspect to make sure there aren't any tears or holes in the gloves. And if they're all intact, you're ready to go.